consumption when pregnant is known to cause health risks to the unborn child. Now, what happens when you're breastfeeding? This is the Health Channel. Alcohol consumption has more problems to the human body than actually its benefits. Now, this gets worse when you're actually breastfeeding. However, studies have been shown that taking one drink in a day does not cause any harm to the infant, as long as at the time you're breastfeeding, there should not be any alcohol in your breast. And just to note, the amount of alcohol in your plasma, in your blood, is the same as the amount of alcohol on the breast milk. So what does it mean to have a drink? What is a drink? According to the American Dietary Guidelines, a drink of alcohol means it's actually 14 grams of alcohol. What does this mean? A beer, as just a standard beer, has 45% of alcohol. So doing 4-5% of alcohol in 500 ml of beer, that means you're actually, if you drink one bottle of 500 ml of beer, you have actually consumed 20 to 25 grams of alcohol. It's clearly that's more than one drink. That's actually 1.5 to 1.8 drinks in a bottle of beer. If you take wine, a standard wine has 12 to 14% of alcohol. A normal serving of wine has 150 ml, depending with how much alcohol is in the wine. So that means in a 12-14% alcohol 150 ml serving, you're more likely to have 1.2 to 1.4 drinks in that one glass. And also to mention this, one drink, that means 14 grams of alcohol, take 2 to 3 hours to completely be cleared from your system. So if you take one beer that has 20 grams, you just multiply 2 to 3 hours times 1.5 or 1.8. That comes to 4.5 to 5.5 hours to clear. So if you're breastfeeding, that means, you see, you do not want to give your baby alcohol through the breast. So if you take one beer, you need those hours before you breastfeed your baby. And the more the number of bottles you take, that means the more the alcohol you take, the longer the hours. So if you do 2, you double the time, 3, you triple the time, and so forth. What will happen if you actually breastfeed your baby when you have alcohol in the system? Number one, you should always remember that the liver in the baby is still developing. So the clearance of the alcohol in the baby's system will take way longer and will strain the liver that is still developing. Then the worst thing is, it actually affects the brain development of your child. This is actually the future of your child you're messing with. So that's why the best thing that you can do to your child is stay away from taking alcohol when you're breastfeeding. And if you must, please do not breastfeed your baby while you clearly know that you've taken alcohol. So what do you do in such scenarios? The first thing you need to do is plan ahead. If you know you're going out and you have to take alcohol when you go out, make sure that you have expressed enough milk to take care of all the hours that your body will still have alcohol in the system. So that instead of you breastfeeding the baby, you can actually express the milk and discard the milk because of the alcohol content in your blood. Because of the alcohol content in your milk. And the second thing is, if you know that you're going out, what you can do is give this baby to someone else to take care of. Because if for any reason you come back, you're intoxicated with alcohol or you're a bit drunk. Number one, so your reflexes go down, your sense of environment also goes down, and that means you can actually even suffocate your own baby, especially when you're sleeping together, if you're co-sleeping with your baby. So please, 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 if you're a mom and you must go out, remember to plan ahead, express milk, and have someone to take care of the baby for you at the time that you must go out and drink. But if you can, for the love of the future of your child, stay away from alcohol, especially in the first 1 year of life. This is the Health Channel. Support breastfeed, support a healthy nation.